Morning, everyone. And I first of all just want to start by acknowledging the Cavan branch of Alzheimer's Society of Ireland, because they're embarking on an ambitious project to make Cavan a dementia inclusive county. So, and I know they have a number of public meetings coming up, so I just want to acknowledge Carl Beattie and all of the supporters there in the Alzheimer's branch in Cavan for the work that they do, and indeed acknowledge the work that both your organisations do to support carers and people with dementia. I suppose just following on, like we're talking about supports for both people with dementia and those that are caring for them, and it can be a very frightening time for someone who's first diagnosed with dementia. So just wondering what kind of supports there are there for people who are in the early stages of dementia, maybe just being diagnosed, because it is frightening and they don't know what's ahead of them. Secondly, just to make a point, I suppose, there's some families, carers who are looking after people with dementia themselves need more help in understanding the disease, because as one family carer said to me, you could be telling the person with dementia to lift their foot and you're getting very frustrated because they won't lift their foot. And it's not that they're not hearing you or understanding you, it's just that the brain doesn't actually send the message to the foot to lift their foot. So it's even for families to get to understand that as quickly as possible. Because one family would have said to me that her father in this case has Parkinson's, so he has dementia associated with Parkinson's, and I know there's different types and it's quite specific as well. But I mean, she said she would love had someone handed them a pack to explain exactly what dementia is. And I know there are brilliant online courses, but not everybody is computer savvy and not everybody even has the time to actually go. Another suggestion made to me was, could RTE or one of our television stations run out a short campaign, because we have so many people with dementia, and therefore we have so many families affected by dementia, and that's set to increase. So even, I'm just thinking of the stroke, that the Irish Heart Foundation, the FAST, that gets through a message what you do. So even some of the things about explaining a little bit about dementia, even like a couple of minutes of key messages, would be something that could help so many people as well. Because they were saying like loneliness is such an issue, and also especially if you're in rural Ireland, where there are maybe possibly no supports, you're dependent on the HSE or an agency providing care. We know the care packages may be approved, but the carers are often not there, and people are left maybe at short notice. Sometimes suddenly a carer can't come, and they just have to cope, and it's very difficult. So just saying, like, if there was again, and even when some of the carers do come, they're not trained in dementia, so they really don't know. So if it was more training rolled out for carers around dementia specific, and I think that was mentioned by a previous speaker as well, but that's very important. And also to make another point, that recently someone who, for a different reason, ended up in a hospital, tried to leave the hospital in the middle of the night because they didn't understand where they were, and were then actually sent to the psychiatric ward and detained there for quite a number of weeks. And that's not the suitable place for them, but it was that the hospital either didn't know how or didn't have the resources to deal with someone. And I understand that they're totally understaffed. They didn't have the resources to try and deal with someone with dementia and keep them in the ward and keep them safe. The only thing they could think of doing was referring them to the psychiatric ward, which is not fair on the person, wasn't fair on the staff in that centre either. So I suppose it's looking at the need for a lot more awareness among our health professionals, a lot more awareness for families, and I think the model of care is there from the different initiatives and pilot programmes there, so it's just what it's going to take to resource that properly to ensure that everyone gets the supports they need. Thank you.
I can deal with those. Thank you, Deputy, and thank you for your comments about our Cavan activities, and indeed your ongoing support there as well. There was a number of points you made there, I suppose. Firstly, in terms of that diagnosis and where to go for help in terms of being signposted, because like any diagnosis, you're into a different environment, different language, there's pathways, etc., and it can be very frightening. And indeed, I went through it myself with my own mum many years ago. In terms of the advice initially, what we have worked at in the last few years, obviously we have our helpline, which is there, and we had, as I say, over 6,500 interactions last year, and they can provide that listening ear, that initial advice, the sort of material that's required in terms of understanding. But what we've rolled out in the last number of years is the concept of the dementia advisor, and we have one in each county. So anyone who rings me or calls me or whatever with regard to maybe a loved one who has had the diagnosis, I would point them towards the dementia advisor, who's a one-stop shop in terms of the services that are available within that county, be the clinical, be the psychosocial, etc., be it the care supports. So that's what I would encourage and urge people to use that service as well. It's been very, very successful over the last number of years, and it provides that link for the person and for the family over the following, it could be months, it could be years, right throughout the journey as well. Because it is a frightening area, and there's a lot of new language, and there's different pieces, even in terms of the model of care. There's lots of moving parts there as well. The practicalities for families you mentioned as well, and that's one that resonates with ourselves, and we deliver family care training on an annual basis, which is dementia specific and has won numerous awards and has been validated through research, etc. And I think we had over 650 went through that last year as well. And there's 6 modules there as well. And it's down to the practicalities, the simple stuff that can be done in the house or the home, which makes it that bit easier, because it explains some of the responsive actions and activities by people with the condition. So certainly we are looking to expand that as much as possible through fundraise monies, through donations, through HSE funding, where we certainly have plans to increase that. But what we have also found following a study this year of it, or last year I should say, is that on occasion when people come to the first 1 or 2 modules, they're not ready. There's a requirement for a degree of counselling, because there's all the emotions of a loved one being diagnosed and having that diagnosis, and nearly the first 1 or 2 modules are very much, quasi-counselling to a certain extent. So we certainly would urge, and we're looking to explore that further this year, the concept of that counselling or psychotherapeutic input for families as well. But in terms of the training, I met a man down in West Clare last summer, and his wife had been diagnosed, and we had a good chat, and just from what I heard him saying, I said, the family care training is for you. And he has started that now in the last few weeks, and as I say, his life has changed at home in terms of the practicalities that he's picking up on there. You mentioned the campaigns as well, and I would refer to the National Dementia Services, which was formerly the National Dementia Office, and the Understand Together piece of that, which is very much around the awareness for the public in terms of what is dementia, how do you become dementia friendly, dementia inclusive, etc. Because it's a whole of society approach. We can open the day service, be it in Cavan or wherever in Monaghan, but there's a lot more there within those communities that can support that person as well. And a lot of that is around the destigmatisation as well. And I think we've worked well on that over the years. And I'd certainly, for my own travels around the country, I would see those levels of stigma have reduced, but not everywhere. Particularly, I would say, in the more rural areas, there's still that level there as well, and that's where you're looking at the whole of community response. And we try to do work as well, as you mentioned, which we'll be doing in terms of the Cavan area around Friends of ASI, getting the local community, the local church, the local GA club, businesses, etc., because we all will play a part. The 4th point you made was around the acute services, and this is something we've been pushing, and in fairness, a number of the acute hospitals have dementia specialist nurses at a senior enough level there as well, and that's to provide that dementia awareness within the acute setting as well, because someone with dementia going through A&E can be traumatised. Yeah. Someone within going through certain diagnostics in terms of screening, etc., can be very, very upsetting as well. So there is a lot of work, and that's been accepted within that acute sector as well. And the HSC have appointed a number of those. I don't have the figures, but certainly it's something we've been pushing for in PBSs over the last number of years. And then finally, the model of care. And I did want to focus in on the model of care in my opening statement as well, because I do think it's a game changer. It's something that you don't see across Europe. It's part of the strategy that we embarked on 10 years ago, but it has been launched now. It has all the pieces. It sets out that pathway, etc. And in fairness, there's certain elements of that in place at the moment in terms of regional specialist memory services, ID services, etc. But the plans for 24 are being impacted by the recruitment embargo as well. And we would hate to see a loss of momentum in terms of what I think is a very, very important piece of work and a very important framework for the future for dementia in Ireland. And that pathway provided for within the model of care, I would say it's pretty unique in the European setting as well. But we have to make it work, we have to implement it, we have to get that ring-fenced funding on a monthly, annual or a multi-annual basis as well.